Welcome. This is Tune Into Your Body. Think about the time when you have been listening to your favorite album, driving in your car, in your home, at a concert of your favorite musician. What happens to your body in those moments? Take yourself there. Take a really big breath. Check in with your body and take yourself there. That concert venue, who were you with? What happens to your body when you hear those favorite sounds? Today we're going to be talking about music and health. I am Dr. Wendy Lee White, licensed naturopathic doctor, nutritionist, and educator, and this is Tune Into Your Body. This is episode 11. Welcome. We are doing this weekly every Thursday afternoon, 1 p.m. Pacific, 4 p.m. Eastern. And most of you will be watching this through Zoom, which required a registration. Thank you. Some of you also are watching through streaming on Facebook. And the reason that I stream on Facebook is so that my dad, who lives in Massachusetts, can participate without having the hassle of Zoom. So you can all, for those of you who are streaming on Facebook and watching it live there, you can thank my dad. So today we're talking about music. And for those of you who are new to Tune Into Your Body, we discuss the 5 essentials for you to be healthier every day. And my goal in this is that I believe living in a manner that encourages your physiology should not be a privilege. I understand that I am coming from a very privileged perspective. I am middle class, I'm educated, I am in white skin, I live in a thin, able body, I am married to a man, I am still authentically true to my gender at birth, or my birth was authentically true to me, I guess is a better way to say it. So I understand that from my perspective, I am privileged. However, I understand that for those who don't have the same privileges, making choices in life might feel unattainable. And I'd like to suggest that we all, no matter our status in the world, have choices on some level that we can make. And my hope is that as we go through this weekly webinars, my blog writings, my newsletter posts, my future book in draft, that there'll be some takeaways that apply to every single human being. I believe that we all are amazing creatures. And if we learn what our body needs and do our best when accessible to make choices that align with those needs, then we will feel better. We will feel stronger. We will feel more resilient. And when we do, we then have less symptoms. Symptoms being headaches, digestive difficulties, aches and pains, and any of those day-to-day things that many people in our culture feel are normal and acceptable. And I would like to counter that to say it is not normal and acceptable to be in discomfort on a regular basis. So what are the 5 essentials for you to be healthier every day? Nourish. That includes food, what you eat and how you eat, hydration, and supplementation. Supplementation is really one of the things that is lowest to my priority list. I would rather have someone look at how they are living, the choices that they're making, and supplementation is just that, to supplement what might not come from diet or lifestyle. So that's nourish. The second is move. And move includes things like exercise that actively moves our muscles and our lymphatics and our circulatory system. But passively, hydrotherapy also comes in that move section. And the hydrotherapy acts to passively, unlike physical exercise is active, hydrotherapy passively encourages the movement, the circulation of your lymphatics and your blood, your arteries and your veins. So nourish, move. The third is choose. And choose really encompasses how we live our life day in and day out. It encompasses sleep, clutter, how you translate your values into your calendar. It includes what chemical exposure you have on a day-to-day basis. That's choose. That's really about designing lifestyle. At the end of this webinar, you will get to the point, I will get to the point, where I will then say, okay, here's your take home. Here are the 3 things that I'm suggesting you play with at the end of, through this week. That's in the choose section. We have choices. Maybe some of them don't seem accessible to you. Maybe you can just pick one that says, okay, I think I can do that. Great, do that. Nourish, move, choose. The 4th is connect. Connect with yourself, being able to be with yourself, identify your emotions, identify your needs, be aware of what your body is telling you. The second part of connect is with others. What is your relationship? How authentic? How open is your communication? Are you leading with your heart rather than your head? And the third section of connect is your relationship with something greater. That may be spirituality or religion, but it doesn't have to be. It can also be your relationship with nature, with a large community of people. It can be humanity. The purpose of the connect with something larger than yourself, something greater, is that we need to feel small in order to appreciate our power. The 5th essential for you to be healthier every day is balance. And that's where your nervous system state comes in. And when we talked about balance in a whole webinar, we explored the various states that your nervous system can exist in and how just that one aspect of your nervous system has influence on everything else. The big spider web of your being, your digestive tract, your mood, your immune system, everything else. Okay, so that's the intro for the 5 essentials for you to be healthier every day. Now let's use those categories, those 5 categories, and let's talk about music and how you can use music to support those 5 essentials. So first, let's talk about the connection between what you hear and your physiology. So sound waves come through the air. They enter your ear, they hit your tympanic membrane, think of it as the eardrum, that's what people call eardrum, and it's a very thin membrane that connects or that separates the outside air from your inner ear. Your inner ear is a fluid-filled space that has 3 tiny little bones in it. So when the sound waves come in, hit that membrane, the membrane vibrates, triggering movement in those 3 little bones in the fluid of the inner ear, which then triggers little hairs called cilia to wave and vibrate, which then trigger the cells that are at the base of those cilia to secrete chemical neurotransmitters. Those neurotransmitters can communicate to the brain, as well as those cilia are attached to nerve cells that communicate through the auditory nerve from your ears into so many parts of the brain. So physiologically, those sound waves from music are making changes to your body. Let's talk about nourish, the first essential. Typically, I think about nourish as food and nutrition and hydration and physical substances that the body needs. But here's the cool part. The Mozart effect refers to the fact that music enhances your cognitive function. You physiologically have a healthier brain when you listen to music on a regular basis. People who have had strokes or traumatic brain injury, Listening to music on a regular basis promotes brain plasticity, which means your brain's ability to be flexible and respond to the world around it, and therefore, along with that, heal from injuries. So while music isn't a nutritional substance, it still provides nourishment to the brain to encourage healing and more greater thinking. When people have heart attacks and they're in the cardiac unit of the hospital and they're getting treated, when music therapy is introduced to part of their therapy, they have a drop in heart rate, their breathing rate slows, and their oxygen demand decreases, meaning they physiologically get healthier with music as nourishment. Let's talk about move. So for me, in that category of move, we talk about active movement like exercise and movement that you physically do. And then there's passive movement, movement that can be triggered by hydrotherapy, for example. In some studies regarding playing percussion, so what does that look like? That looks like playing the drums or a bell. So you can see that I'm actively moving my body here. I love that in this study, they particularly noted whether it was tuned or untuned, the benefit of playing percussion was the same. In other words, you don't need a fancy drum set. You can play percussion on your table and you have the same physiological benefits. Playing percussion, tuned or untuned, increases psychological well-being, decreases anxiety, which we'll talk about a little bit in the balance section, increases energy, and decreases signs of depression. In those who are older, 65 years or older, when they moved in time to music, now that doesn't mean dancing, although essentially that's what dancing is, moving in time to music, but this can also simply mean using your foot to tap along with music, or using your hand to tap along with some music, or swaying in your chair, or walking in place, or dancing, of what we would think of as a full body coordinated movement to music. Age 65 and over, for people who'd had practices of that nature, they had better gait, meaning their body's organization and coordination of taking one step and then another and then another. And I'm exaggerating it here, but you can see that there's a natural movement of the body from side to side when someone is coordinating their steps. They had better gait, that better coordination when walking, and they had fewer falls when they moved in time to music. That's the benefit of music in relation to move. I'm going to pause here and just introduce and catch you all up for those of you who are just joining me. This is Tune Into Your Body, my weekly webinar. This is episode 11. And I'm Dr. Wendy Lee White, licensed naturopathic doctor, educator, and nutritionist. And I'm offering these weekly webinar sessions to empower each and every one of us, no matter our level of privilege, to be able to increment choices in our lives on a regular basis, small choices day to day, baby steps, that encourage our bodies to encourage us to tune into our bodies first and foremost, to hear the information that our body provides. And secondly, to be able to encourage our bodies to be well, to be less symptomatic, to be more strong, more vital, more resilient, and have less symptoms. I don't want any human being to feel discomfort or pain on a daily basis. That isn't necessary. We can do better for our culture, for our humanity, than to allow us to think that that's okay. So today we're talking about music and health. And I pick music because we all have access to music. We all have access to birds or to body percussion or to some level of live music or recorded music. We all have access to something to pound a rhythm on. We all have voices, we can sing. I sing with Aurora Chorus outside of COVID time, and that is a beautiful expression of women's voices in song together in love and empowerment. You can tell that it's quite a passion of mine, but we all have the ability to do this on one level or another. And I'm taking music and health and fitting it into the 5 essentials. We've talked about nourish, we've talked about move. Now I'm going to skip choose till the end because those are the areas that you can implement. That's going to be your homework. So let's talk about connect. I talked about the fact that there are 3 aspects to connect: with yourself, with others, and with something greater. So let's talk about yourself. How can music facilitate your connection with yourself? And this one I don't have a study for per se. I could find one if you'd like, but I don't have a study prepared for, per se. But I want to give you an example. There is a group, a musical group called Beautiful Chorus. And it's often what I play when my body is feeling raw, overstimulated, anxious, potentially overwhelmed, all of that upregulated, uncomfortable sensations. So Beautiful Chorus is one of my go-tos. And here's why. They have amazing harmonies that give me goosebumps. And they sing about love and the fact that we are powerful and the fact that we can make choice in our lives. And it makes me feel more optimistic. It helps me to connect with the power that I do have on those days where I feel as though I just am not in touch with the amazingness of myself as a human, and I just need a little bit of oomph. So check out Beautiful Chorus. The second one is others. The second part under the heading of connect is your connection with others. And as I opened this webinar today, I suggested that you go back to an experience that you had. When was the last time? Now I know we're in COVID-19, so I know it's been a while since you went to a live concert, but think about with whom you went. And think about how the shared experience of that music concert affected or had an impact on how close you felt to that person. There's a quote from a Harvard article, which I'll give you a little bit of reference to at the end, that said people who attended concerts and plays rarely or never were 1.57, so over 1.5 times more likely to die during the study period than people who attended frequently. In other words, attending music concerts and plays makes you live longer. And hopefully in this, considering this 30 minutes, you'll understand the physiology of how music can increase your health. So let's talk about balance. Again, we'll get to the idea of choose when we get to the end because that will give you your homework. So let's talk about balance. Balance refers to the fact that the state of your nervous system has a great influence on all systems of your body. Our nervous system can exist in 2 areas, mainly: sympathetic nervous system and parasympathetic nervous system. The sympathetic nervous system is really that upregulated, we often have heard it referred to as fight or flight. That is when you're under threat or when you're in a new situation and you're really evaluating your environment, you're kind of up, you're hypervigilant because you're paying attention to see, oh, is this danger? No. Okay, is that danger? No. You can see even in my speech increases, my heart rate increases. I am ready for a confrontation or to run. Sympathetic nervous system. Parasympathetic nervous system historically has been lumped as one part of a nervous system that is rest and digest. The newest theory is called the polyvagal theory. And you don't have to worry about the names, but the idea is that part of our parasympathetic nervous system is safety. The other part of our parasympathetic nervous system is when the world is so too much that we have to curl up in a ball and power down in overwhelm. So there's the fight or flight in the sympathetic nervous system, that go, 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 hypervigilance, takes a lot of energy. Then there's the rest and digest part of our parasympathetic that is calm, really focuses on digestion, absorption, detoxification, elimination. Our immune system is upregulated when we're in this parasympathetic rest and digest state. And then the last state is when your system is just overwhelmed, it has to shut down, curl up in a ball to protect the vital organs, and that is the overwhelm part of the parasympathetic. So think about this for a minute. Where do you think your nervous system would be if you were in anxiety? Increased heart rate, racing thoughts. What part of the nervous system does that remind you of when I just gave you those descriptions? Sympathetic nervous system, that fight or flight. Music, back to our topic of the week, music soothes anxiety. It helps your body physiologically. Now, I want to make this point here. We often think about our mood states as like a mental, and it's separate from our physical. And I really want to work to dispel that compartmentalization, that our mental, emotional, spiritual, and physical aspects of ourselves are all tied up. Think of that big spider web that I refer to. It's all connected. So when we talk about our mood or our emotions, physiologically, it's connected to the functioning of the rest of our bodies. So regarding soothing anxiety, back to that playing percussion, that increases psychological well-being, decreases cortisol, which is one of our stress hormones, and increases relaxation. Also in the realm of anxiety, listening to quiet instrumental music can reduce cortisol as well, reduce that stress response. So I just talked about two very different things. Playing percussion, which you'd think about as faster paced and fun, and listening to quiet instrumental music, which you think about encouraging that parasympathetic rest and digest. Both of them reduce cortisol. How can that be? I'm often reminding someone to tune in to their bodies, hence the name of the show, to see what works for them. There are some people, when they are anxious, they have an abundance of anxiety and energy that they have to discharge. Interestingly enough, most people in blood group O tend to be in this camp. They have this anxiety and this energy that they have to discharge somehow. Running, walking, swimming, hiking, or percussion, banging on drums. That for them would reduce their cortisol. For me, it might stress me out and upregulate me too much and actually have the opposite effect. But knowing my own system allows me to make that choice. The listening to quiet instrumental music is more likely what would work for reducing my cortisol, my anxiety, my stress level. So take a moment and think about when you feel most anxious, most upregulated, hypervigilant, those words are kind of descriptors of each other. What helps you? Is it playing percussion? Do you have energy that you have to get out before you can calm down? Or do you just need facilitating in that calming down? Playing percussion or listening to quiet instrumental music? There are other studies, we've just talked about anxiety. There are other studies regarding depression. Listening to bright, cheerful music, that was the language used in the study, the research study, I lost the word, bright, cheerful music. Now you can imagine that that varies person to person, right? So if you're someone who is prone to depression, prone to overwhelm, prone to your body just powering down because it's just had enough, find what bright, cheerful music does it for you. One of my favorite songs that makes me stand in the living room and dance is Crazy by Seal. I danced through that through pregnancy. When my daughter was little, I'd turn up the radio and we'd dance together until she said, "Mom, turn it down too loud." And now she's older, and just last fall, we danced in the living room to Seal when I was having a hard time. So bright, cheerful music, again, depending on your individuality, you need to experiment to find what works for you when you're feeling that overwhelmed, depressive feeling. There's a lot of studies that talk about listening to preferred music, again, individual based on the person, improves medical outcomes. The cool part is even when the patient is not conscious. So subconsciously, the body itself, without the mind involved, hears the music and the physiology changes anyway. Consciousness is not required. Some of the medical outcomes they've seen are lowering blood pressure and decreasing the need for sedative medications. Anytime you can decrease the need for a medication and use a lower dose is going to convey less risk. So we have now talked about 4 out of the 5 essentials for you to be healthier every day as it relates to music. The last one is choose. That's where I typically talk about sleep and chemical exposure and translating your values to your calendar and all of how your day-to-day decluttering and your pace, all of that falls under choose. Why I decided to end with choose today is it depends how you can listen to this webinar, but unless you have a takeaway that you can put to practice in the next week, it's fun, it might be interesting, but it's not going to have the lasting effects that I would hope for you. So let's talk about choose as it relates to music and health. If you are someone who, when they are anxious, when they're upregulated, they need to discharge, how about playing some percussion in the evening after dinner to help discharge that extra energy so that your body is more likely to be able to power down for sleep? Conversely, if you're someone that tends to be like myself, upregulated, hypervigilant, and playing the drums in the evening would just amp you up even more, then quiet instrumental music before bed is what your individual body could use to help your nervous system power down to be ready for sleep. So before bed is a perfect time to practice anything related to the nervous system so that when we get to sleep, we can get the restorative rhythmic sleep that our bodies need for, again, all aspects of this big complex spider web. When you listen to upbeat music, your favorite music, your bright, cheerful music, whatever that means to you, when you do that when you're feeling sad or depressed or overwhelmed or shut down, your physiology will respond. So we often feel like our emotions can control us. But I want you to know that you have tools to be able to flip the switch so that your nervous system responds appropriately to actions you choose. Music is a perfect example of that. So earlier, I alluded to a resource for you. If you go to health.harvard.edu and you search for music and health, there's a great article that talks about a lot of aspects of these. I'm going to do a little station identification one more time, and then I will leave you with a quote. This is Tune Into Your Body, episode 11. I'm Dr. Wendy Lee White, licensed naturopathic doctor, nutritionist, and educator. I'm here discussing the 5 essentials for you to be healthier every day. I want us all to be more resilient, more strong, more powerful, more clear thinking, and have less day-to-day symptoms because we are amazing beings, and the more we learn about ourselves, the more we're able to make choices in life to align with that physiology. So here's the quote from that Harvard Health article that I will leave you with today. Today's doctors tell us that music can enhance the function of neural networks, your nervous system, slow the heart rate, lower blood pressure, reduce levels of stress hormones and inflammatory cytokines, which is how your body responds to immune insults, and provide some relief to patients undergoing surgery, as well as heart attack and stroke victims. That's just music. No drug can make those claims. That is a lifestyle choice that we have the power to expose ourselves to. On that note, I wish you all well. This is a weekly webinar, so next Thursday, 1 p.m. Pacific, 4 p.m. Eastern, we will have episode 12. And I will begin talking about health at every size and my passion for working with those who live in a larger body, getting them out of the guilt and shame and diet pressure world and honoring their bodies for the amazing creatures that they are. Tune in for that next Thursday. And don't forget, play with music before bed, when you're feeling anxious, when you're feeling sad, when you're feeling depressed. You have tools. Good luck and take care.